on the News Channel 5 network. This is OpenLine.
Good evening, everyone. Welcome to News Channel 5 Plus. I'm Casey Mason, and you are joining us here tonight for a very special episode of OpenLine where you can indeed ask the expert. Tonight we're talking about if you or someone you know has ever struggled with any sort of addiction or mental illness. And of course, joining us tonight is our special guest this evening. This is Siobhan Morse. She's a Division Director of Clinical Services at Foundations Recovery Network. Siobhan, thanks for joining us this evening.
Thank you for having me.
We have a lot to talk about tonight, but of course, we want to remind you at the top of the show here that if you know someone that's maybe struggling with addiction or mental health issues, if you have any questions, looking for some advice for loved ones or even yourself, please feel free to call in tonight. That's what this show is all about. Indeed, OpenLine. The number is right there on your screen. That's 615-737+. We look forward to hearing from you. Well, Siobhan, first of all, let's talk a little bit about yourself. Tell us, who you're joining us from tonight, Foundations Recovery Network, what it is, and what you do.
Great. So Foundations Recovery Network, we're a network of treatment providers for addiction and mental health illnesses. We have 18 facilities around the country. We have both residential and outpatient treatment available.
So if you've never heard of it, obviously there's a lot of locations around just Middle Tennessee as well as everywhere. Tell us some of the locations and really kind of the gist of what you all are all about.
Absolutely. So in Tennessee, we have a residential facility in Memphis. We have an outpatient facility here in Nashville, and we have another outpatient facility in Memphis as well. At the heart of who we are and what we do at Foundations Recovery Network is the patient who struggles with both substance use and mental health illnesses. We are considered by many the gold standard in treating those patients, and then that's our specialty.
Of course, Siobhan, you look forward to taking calls from folks tonight. We look forward to hearing any questions, stories maybe you want to share. Now, you are the Division Director of Clinical Services. Tell us a little bit about what all that entails in your job title.
Sure. So I hold our system of care. One of the things that differentiates us from many others in the space is that we have a core program that we translate across all of the different facilities. It's very intensive on integrating the treatment for both mental health and substance use disorder, as well as very patient-centered and focused. The other part of my job that I love is I get to hold the research as well. I'm responsible for a 10-year program that we have, that we've been running consistently, that looks at long-term outcomes for our patients. We're able to track our patients, over 60% of them, 1 year after treatment, and look at those results. And I'm really proud to say that overall we exceed national averages for those long-term positive outcomes.
You know, also you kind of go and teach folks your understandings and your research. Tell us about that.
So as part of the research piece and the clinical director piece, I get to go around the country. I go to conferences, and I get to share our information, share both the process by which we provide treatment and collect outcomes, as well as some of the really interesting new findings that we have as we do our research. It's an honor to be able to do that and to be able to participate in that type of thought leadership for the industry.
I'm sure. At Foundations, you all specialize in dealing with evidence-based practices. First, explain what exactly that is and why it's just so vital to this type of treatment. So,
for a really long time, people considered any type of psychological treatment to be like a soft science and very touchy-feely, and they never, people don't think of it in the same way as medical science. But the truth is, everything in psychology and in substance use treatment has been really well researched. And what they have found is there are certain interventions, modalities, methods of treatment that produce positive long-term outcomes. And so those are considered evidence-based, meaning the research has provided evidence or demonstrated that these are effective.
So throughout tonight's show, we're going to be hanging out with folks for about an hour here on OpenLine. Just as people are joining us maybe here just now tonight, what are some things that we're going to cover that you really want to talk about, just to give people kind of a tease as to what's going to be coming up tonight?
So for me, very close to my heart is the idea of what is addiction. In distinguishing the disease concept from just maybe a moral failing, or someone who doesn't have the willpower to make a change, and really distinguishing that addiction, substance use disorder is a disease state of the brain.
Well said. All right, moving on. Again, just want to remind folks to call in at any time tonight. Let's talk about the treatment centers. They are here locally and across the nation. What exactly does the patient population look like at those?
So actually, anyone from 18 to 80 has been our population, right? It spans the age range, all different ethnicities. We treat both genders. We have one facility that separates males and females, and they have different campuses. So, for example, you know, dealing with trauma issues, getting just that, you know, especially for women, but also for men, that that campus that is just feels a little safer. Right, so that's in Palm Springs, California. It's called Michael's House, and we have several. Oh, beautiful! Yeah, and here in Nashville, for example, we have a beautiful right here downtown outpatient facility. It's warm, loving staff, really welcoming, provides day and night treatment, and it's convenient, and outpatient allows you to continue with your life and your everyday. So.
Now, you all have a really interesting purpose statement. It's creating lifetime relationships for long-term recovery. What exactly does that mean? So
the truth is, recovery is a long-term process. But if you really sit back, and whether you have a substance use disorder, a mental health disorder or not, you know, by the time we're 14, we're all recovering from something, right? Something happened, if you really think about it. And so, and that takes time. And there's a process that goes with that. And so, that's also one of our core philosophies, this idea that recovery is a long-term process. And so, you know, you don't change providers every time you get a cavity. You go to the same dentist as long as you can. And we're in it for the long haul. We want to be the go-to. We want to, it's such an honor to accompany someone through this type of a journey, through this journey of self-discovery, of change, of transformation, and our commitment is to be there with people and for people for you know, as long as it takes.
Now, you all offer a lot of options for treatments. Let's go through some of those options.
Sure. Residential treatment. So often, what you find is that people wait until things have gotten pretty far down the line, till their feelings of powerlessness maybe or hopelessness are pretty high, and they're having some major life issues. So we offer, oftentimes what ends up happening is you come in first, you go through a period of, say, detoxification and stabilization for 3 to 5, maybe even 7 days, depending on how you're doing. And then after that, you'll move to a residential part of the facility where you've got freedoms, you go to groups, you meet with individual therapists, you build relationships with other patients, and you learn how it's such a beautiful transformation process. I worked for 7 years in the field, and to watch patients, you know, come in who are so sad and beaten down and hopeless, and to see the life come back. Right? To see the little shine in somebody's eye, to see, it's almost watching the wake up, right? And so patients then stay for a period of time in residential. What we recommend following residential, because of the long-term nature and the progressive nature of this disease, is that you then go to the next level, which would usually be some form of outpatient treatment with. So it might be outpatient with specialized housing facilities, or it might be returning to your home and doing outpatient, you know, in the evenings, just to keep, the research shows that it's the length of being engaged in therapeutic services is one of the most important factors in producing long-term positive outcomes. So the beautiful thing is, though, that no matter where someone is in their process, or even in their willingness, right? So maybe you're pretty far in your process, but you're not quite ready to go away for 30 days. Like, so the outpatients afford the opportunity to say, okay, so we'll meet you where you're at. Let's see if we can make this work in an outpatient setting, and you can enter sort of the continuum any place that fits for you. Another one of our major core philosophies is we really strive to meet people where they're at, with acceptance and without judgment.
You know, what is one of the biggest misconceptions that you maybe want to address tonight?
So it's
I know it's a tough question.
No, it's okay, but no, it's probably the family member who has a loved one who, it's not out of a lack of concern, but the feeling is just, why can't you stop? Why can't you change? Because it seems, you know, maybe their loved one is able to go a day or a couple of days, but then always seems to go back. And I want people to understand that that this is a brain disease. That is one of the symptoms, is that return, that chronic relapse, that need for something to feel better. It's most times not that the individual doesn't want to stop, that the individual doesn't want to demonstrate to the people that love them, you know, that they love them back. But you know, the disease process is very very scary, and so it leads people back to relapse so often.
Well said. Much more with Siobhan Morse from Foundations Recovery Network coming up right after the break. Keep it right here on Open Line.